Hello friends, in this video we are going to talk about the pathologic calcification. What is pathological calcification? Abnormal deposition of calcium salts in tissues other than osteoid or enamel. It is known as pathological calcification. It may be associated with small amounts of iron, magnesium and other minerals also. So now let's talk about there are two types of pathological calcification, dystrophic and metastatic. So let's talk about the dystrophic calcification. Deposition of calcium salts in dying or dead tissues. 3 points you have to remember about dystrophic calcification. Dystrophic calcification is that it occurs in dead or degenerating tissues. Serum calcium levels are normal and often causes organ dysfunction. Seen in the necrotic tissue calcification in caseous enzymatic fat necrosis, in dead eggs of schistosoma, cysticercosis, and hydatid cysts. Also seen in the degenerating tissue such as the heart valves, then atherosclerosis, goiter of thyroid, dense old scar, cysts, etc. So now, Munkenberg's medial calcific sclerosis. It is the calcification in the media of the muscular arteries in old people. A single necrotic cells on which several layers of minerals get deposited progressively to create lamellated shape called samoma bodies. Here you can see the samoma bodies in this image. You can also remember the mnemonic ABCDE of dystrophic calcification: atherosclerosis, samoma bodies, caseous necrosis, damage heart valves and dead eggs and parasites, and then enzymatic fat necrosis. These are some of the examples associated with dystrophic calcification. Now let's talk about the metastatic calcification. Deposition of calcium salts in the normal tissues. It is associated with hypercalcemia secondary to deranged calcium metabolism. Okay, a point to remember about metastatic calcification is occurs in normal living tissues associated with raised serum calcium, does not cause clinical dysfunction. Dystrophic calcification mostly causes organ dysfunctions. Causes of metastatic calcification is the increased secretion of parathyroid hormone, which leads to the bone resorption. Okay. The other causes are destruction of bone tissue secondary to primary tumors of bone marrow, such as the multiple myeloma, leukemia, and other metastatic tumors of to bone. Okay. Then vitamin D related disorders, renal failure. Renal failure causes retention of phosphate, leading to secondary hyperparathyroidism. The mechanism is that when the phosphate increase, then to decrease the phosphate level, parathyroid hormone is released. So this condition is known as secondary hyperparathyroidism. When calcium is decreased, then also parathyroid hormone is released. It is a counter-regulatory mechanism. And other causes are the sarcoidosis and milk alkali syndrome. Sites involved in the metastatic calcification is the lungs, alveolar septa of the lung, then kidney, basement membrane of the renal tubules, blood vessels on the internal elastic lamina of systemic arteries and pulmonary veins, stomach, interstitial tissues of the gastric mucosa. Common site are, as we have seen, lungs. Lungs is the commonest site. Kidney, blood vessels. In blood vessels, systemic arteries and pulmonary veins on the internal elastic lamina. Then stomach grows appear as fine white granules. Appear as fine white granules or clumps, feels gritty and sand-like. Now, in microscopy, basophilic amorphous granular, clumped appearance. Okay, some things you have to memorize. So, one point remaining is that massive deposits of calcium in the kidney is known as nephrocalcinosis, and it can lead to the kidney damage. So, this is all about the dystrophic calcification and metastatic calcification. Hope you have enjoyed the video. Thanks for watching.